All right, welcome to the Daily Briefing on KLAM and KCDV. It's Tuesday, May 26th. We're glad to have Mayor Koplin back with us for today's chat. Want to remind you of a couple of things. First of all, stay tuned after the visit with the mayor because we're going to share again the information about 424 info in case you hadn't heard about that. Mayor Koplin and I kind of ran out of time to include that, so I'll include it for you at the end. Also, these programs air on the radio in the 1 p.m., 5 p.m., and 8 p.m. hours on KLAM and KCDV and can be found archived on our YouTube channel at youtube.com/Cordova TV. Mayor Koplin, here we are back for another one of these visits and got a little fish in the freezer, I guess. Did some fishing over the extended weekend?
I did. I got a nice halibut and already had some in the freezer, so I did some social sharing.
There you go.
And the good kind.
Yeah, I guess. Okay, well, nothing real super significant developed over the weekend that I can recall, so I guess we'll mostly be looking forward here. And let's start with sort of the major item, this city council meeting that's coming up.
You bet. So the question on everyone's mind at every level of our country is reopening. So reopening Cordova looks like really a jump start tomorrow at the Wednesday special city council meeting. Your representatives will be discussing whether to move to the 100% reopen plan put in place by Governor Dunleavy, or to remain at Phase 2, or to move to Phase 3 of the Reopen Alaska plan. Sounds like a mouthful, but it would be a good time for you to weigh in and send your comments to council members and share your thoughts and opinions. That call-in number tomorrow will be 253-6202. So right now, Cordova will remain in Phase 2 until possibly June 1st. However, the council might act to extend it for longer or to align with the state status sometime in that May 22nd to June 1st timeline. So that special meeting tomorrow is to consider those options. And at this time, the city of Cordova is firmly committed to Phase 2 and allowing our community to softly reopen while yet remaining cautious as we approach the crescendo of the fishing season. As in other Alaskan communities, the city manager attempts to assess the will of the community, the medical team's guidance, and the incident management team to allow time for input and feedback on Cordova's future steps.
And, along that line, I did some research. I don't remember if we talked about it Friday or not, but I did some, there had been some lingering questions about whether cities can remain with tighter restrictions than the state, and that was unequivocally the case. And, I can share the documents with anybody who wonders about that, but the city is allowed to move at a different pace than the rest of the state. A document came out a while back from Dr. Zink about this idea of expanding social bubbles and gradually beginning to reconnect with people outside your immediate household. That generated a question to the Cordova Prepared email. Let's go over that.
You bet. And a lot of this response is from Dr. Sanders. Yeah, and in response to that email, extending your social bubble to include, for example, elders or other family members or friends. Here's what Dr. Sanders shared. She said, "This is hard because we do want people to get back to what will become normal with social distance, hand hygiene, cloth face covers intact. This doesn't mean that we want to return to a pre-COVID life. Coronavirus has not got here to our community yet. It likely will soon, just as we knew it would with the influx of people, and that influx has just begun. One isolated case gave us a tiny test, but we have yet to see the illness really arise to count. I expect, this is Dr. Sanders again, I expect this will be soon, and it's still a very dangerous disease. So each person we contact and spend time near without protections increases our level of contact. If we go back to pre-COVID life, we will not be looking at the flat curve we have today. People must continue cautiously. With a tight-knit community, the web of contagion contacts can reach through town quickly if we're not cautious. Just as with every other disease and safety guidance that the medical team gives people, we always rely on individual compliance to keep themselves and their families healthy. In my opinion, wearing a mask, social distancing, hand hygiene, avoiding large groups and contact with no household members falls into the same group of advice as eating healthy, exercising, wearing a seatbelt, helmets, not drinking and driving. People have to make choices for themselves and for our community. Each family and group has to make their own decisions. I'll always tell people to follow their gut. So that's Dr. Sanders' advice is, again, be cautious and follow the rules.
And again, that was an answer that she wrote to a question to the Cordova Prepared email, cordovaprepared@yahoo.com. Obviously, the kind of good advice you would expect from one of our doctors. Now, moving along, hand sanitizer for local businesses is something that's been discussed at the last few council meetings, actually. There's a development there.
Yeah, so we have an update, and again, as businesses try to reopen, there are a lot of stringent requirements in place. One is to have hand sanitizer on hand. So the city of Cordova has been able to purchase hand sanitizer for local businesses, and with the assistance of Anchor Auto Parts, Napa, that sanitizer is going to be distributed to first responders and then through Napa to our local businesses. There's going to be no charge for it, but there are fairly limited quantities. The distribution is going to take place this week. Please call Napa first. And work continues to obtain both dispensers and additional hand sanitizer for the season and the foreseeable future. So we really want to extend our appreciation to Napa and the city of Cordova for trying to work with businesses to help put them in a position to reopen because they just can't get access to some of these things they need.
Okay. Yeah, well, that is it's great for them to pitch in. There's a road closure now I see on our list here that needs to be the information needs to be out on that, having to do with one of the processors.
Yeah, so the processors have really well-developed plans, and one of those elements is to try to expand their area to allow their staff to move around a little bit while staying kind of on their campus sites. So for Trident Seafoods, they got permission from the city and the incident management team to close down Jim 4 Avenue in front of their facility as Marine Way. So there's going to be 3 roadblocks that include Jim 4 Avenue and Breakwater Avenue, and Jim 4 Avenue and Haida Lane, and Marine Way and Industry Road. And you'll see those markings up, but that's going to be a detour for the summer, again, to help protect the community and make it easier for the processors to implement their plans and keep the community safe.
It's interesting. On the subject of the processors, there has been some news over the last, here again, I can't remember how many days, but where a few more cases of out-of-town workers, not in Cordova now. We don't have any more cases in Cordova, but they found one in Valdez and a couple in Kenai. As you reflect on that, does that give you pause or does that give you confidence in the system that's in place?
Actually, both. It warns us that we do have these asymptomatic cases lurking, and if we don't catch them, if we don't act cautiously and follow the rules, and they can be causing silent spread, it's a problem. However, the processors and the proactive communities and Mayor Jeremy O'Neill in Valdez and I keep in very close correspondence, and he got a hold of me as soon as they had the case surface. But they had reached out and worked with a processor to do 60 tests, screening tests for the processor, and they found the asymptomatic case. So I think that's we can chalk that up as a system that's working. And in the context of reopening Cordova, I think it's really important for businesses to recognize our medical community being proactive and offering the free testing, and they should take advantage of that. At least, as our medical team recommended, at least just get one initial screening test as you reopen your business or have your workers come back to work in frontline positions, just to rule out an asymptomatic case that could spread to customers or business associates.
Yeah, well, that's an interesting idea, too, for all of the businesses to kind of follow what has so far seemed like a very successful processor model. And let's talk actually test results now, the latest batch. How many have we done? What are we learning from them?
Well, we've continued to apply tests, and as of midnight Sunday night, 390 tests have been concluded, one active test result, and 392 negative test results.
It was actually 397. Yeah.
Yeah, 387. So there's only 4 test results pending. So that's a 0.25% active test, but of course that's the important one. And we do have testing capacity of over 1,100 tests available.
Okay, and like you said, for individuals who are curious or for businesses who maybe think, it's like you were saying before, that what the processors are doing, screening everybody first, is a good idea. Anybody who wants testing can get it. So why don't we run that down again quickly?
Exactly. So from 2 to 4 p.m. Every day of the week, you can get free testing. On Mondays and Wednesdays, that's 2 to 4 p.m. at the Alonka Community Health Center downstairs across from the Episcopal Church. And today and Thursday and Friday, 2 to 4 p.m. at the Koplin Community Medical Center in the Ambulance Bay. You can call ahead to the Alonka Clinic at 424-3622. And for tomorrow, Thursday, and Friday, you can call ahead to the Koplin Community Medical Center at 424-8000. And if they are backed up, it can save you time by calling ahead, and it can suggest a good time for you to come in.
Okay, and one more question. You have made it a point to be out and about with your mask, of course, and kind of observing, how everybody's doing. It seems like following the rules and understanding what's going on. How does that, if you had a chance to get out a little, how does it look like things are going?
I think our ambassadors and harbor teams who are spreading the word about the local rules are really helping to keep the compliance fairly high. But I have been seeing some relaxation on my part. Occasionally people in the stores that aren't wearing a mask, which is very concerning. And then to a lesser extent, down in the harbor, I occasionally see someone wearing a mask. And that doesn't concern me as much out in the open air. But again, we are still in our peak season, as Dr. Sanders has mentioned, and we don't want to get back to where we were. Everything, we've come too far and put too many safeguards in place and invested too much to not just take these very simple and very low time commitments steps to wash our hands and wear our masks. So I'm a little sensitive to it right now, but we need to be. As we relax the rules again, we can't relax those safeguards. So I just want to keep emphasizing how important it is to protect our community and our fishing season and our businesses to keep following those rules.
Yeah, well, because it really falls to all of us now as the rules go away and more is invested in individual responsibility, which is something that, quite a few people in the community have said that they want. But it's very easy to screw that up, obviously, and force the experts to recommend things being restrictive again if we, if all of us in the community don't do everything we can to keep the curve flat. And I mean, you can't get much flatter than zero, so we're doing a good job here so far. Anything in conclusion before we wrap it up here?
I'm just going to remind people to follow the rules in place. We still do have a quarantine requirement for anybody arriving to Cordova from out of state, including residents that are returning from out of state, and that requires the self-quarantine for 14 days. Now, with the only exemption being for essential health care and emergency services employees.
Sure.
The social distancing is still in place. Maintain a social distance of 6 feet. And again, please be respectful of the measures put in place by our local businesses. Just because they're allowed to softly reopen doesn't mean that they're choosing to. And especially some of the more high-touch, high-risk businesses I've talked to have opted to wait a little bit. So just please respect that they're trying to protect their customers and their employees as we try to get back to a normal here.
Okay, well, sounds good. And hopefully we'll get a chance to visit it again tomorrow. I'm glad you had a good weekend, and thank you for the time today.
Thanks, sir.
We appreciate Mayor Koplin being able to join us again. Always a great source of information. And speaking of sources of information, let's remind you again about 424-INFO, the city's new COVID-19 info line. 424-INFO, I-N-F-O. They've put that in place so you can call and talk to somebody, one of their knowledgeable staff, to get answers to your questions regarding the situation. Lists of phone numbers for local assistance groups, links and numbers for state financial and food assistance, current information on the Cordova health mandates, current phase data on the Reopen Alaska plan and how it relates to Cordova. For example, we're in phase 2, whereas the state has moved beyond that. You can get help finding the different forms and information that the city has and that the Chamber of Commerce has. You can get details on testing with CCMC in Alanka, and a place to voice questions and concerns and hopefully find answers about COVID-19 and what the community is doing to mitigate its effects. 424-INFO is the number. 424-INFO. Glad you could join us. Your briefings come in the 1 p.m., 5 p.m., and 8 p.m. hours. Don't forget the city has its YouTube briefing at 4 p.m. this afternoon. That's on their YouTube channel. We'll archive that as well. This program right here will be archived at youtube.com/Cordova TV. And we'll resume our regular programming now on the Clam and the Eagle.